This episode, we would travel back to Japan and Korea to explore 3 cases of stomachache. None of them have stomach issues. Can you guess what is the cause of the stomach pain? In Seoul, South Korea, a 77-year-old woman presented with recurrent epigastric pain, but without fever or chills. CT revealed a dilated common bile duct that harbored multiple cholangitis. Endoscopic retrograde cholangiopancreatography (ERCP) was performed, and the stones were extracted. She was then discharged. The story did not end here, so if you're interested, you can read their article for this special case. In Japan's Tajimi Hospital, a 77-year-old Japanese man with a 30-year history of alcohol drinking was admitted because of epigastric pain. His laboratory data on admission showed an elevated level of GGT of 114 international units per liter. CT revealed a low-density mass in the left lateral segment. Magnetic resonance cholangiopancreatography (MRCP) revealed stricture of the intrahepatic bile duct with pre-stenotic dilation in the left lateral segment, which encouraged them to perform an ERCP scan. Endoscopic retrograde cholangiography (ERCP) revealed bile duct stenosis in the left lateral lobe and pre-stenotic dilation of the bile duct. Brush cytology specimens obtained from the stenotic portion of the bile duct showed no malignancy. Although no direct evidence of the malignancy was obtained, intrahepatic cholangiocarcinoma was diagnosed on the basis of the imaging finding, and surgical left lobectomy was performed. Macroscopic examination of the resected left hepatic lobe revealed a whitish nodular mass measuring 4 × 3 cm, spreading along the hilar bile duct. Histological examination showed diffuse, severe lymphoplasmacytic infiltration. Immunohistochemically, abundant plasma cells were positively stained by anti-IgG4 antibody. Postoperative laboratory values showed elevated IgG4 of 231 milligrams per deciliter, while normal values were supposed to be under 134 milligrams per deciliter. The final diagnosis was IgG4-related sclerosing cholangitis. Just to clarify, this is not a cancer. It is an autoimmune disease. In Hiroshima Red Cross Hospital, in Japan, a 40-year-old man had recurrent symptoms of severe epigastric pain and fever since he was a schoolboy. He went to the hospital for examination, where a surgery called a laparotomy was performed. The left hepatic lobe was discovered to be atrophic, and its capsule was regionally fibrous and cicatricial. Cystic and cylindrical dilatations of the bile duct filled with pigment stones were observed in the resected specimen. His case was concluded as a congenital bile duct dilation, and he has been doing well for the last 10 years after surgery. In the report by the Japanese doctors, they have also noted 6 cases of congenital dilation of bile duct. Anatomically, the bile duct is a network of branching tubes that transport bile from the liver and gallbladder to the small intestine. The common bile duct is a 6 to 8 cm muscular tube of a diameter less than 1 cm, running behind the duodenum and the head of the pancreas. It looks like a small straw sitting deep inside the body. In this tiny tube, stones or cholangitis or even cancer can occur. In order to investigate, blood tests, different types of imaging, especially MRI, as well as MLCP and ERCP can help. Although ERCP is a risky operation, it can be used to retrieve bile duct stones, as demonstrated in the first case. This episode, we explored 3 cases of epigastric pain across Korea and Japan. All 3 cases presented as stomach pain, but it turned out to be a bile duct pathology, including cholangitis and bile duct dilation. In the next episode, we will continue to explore the different stories of stomach pain.